VidaPost is basically focused on really improving the care coordination of providers. And as we look at care coordination, we're not just looking at improving the management of care, as health and wellness is always my main focus. We're looking at how can we improve the everyday care on an ongoing basis. But we have to really understand who is providing this everyday care. And we know it's not just the physician's job to manage everyday care. 800,000 physicians in the U.S. can't possibly manage the everyday care of 133 million Americans with a chronic condition. So now our caregivers are taking on that load. They, as we saw in some previous slides, spend about 20 hours per week doing this. What I've seen throughout my years of providing care is there's 15 to 20 providers per patient that's outside of these medical providers who are working with these patients on an ongoing basis. So our focus at VidaPost is really focusing on those millions of providers who are outside of this medical setting, providing daily, weekly, and ongoing care. We believe at VidaPost that every single one of us has a role to play as a provider, a caregiver, and a patient. So some examples of who are these providers. These providers are people like myself who are home health aides, personal trainers, behavioral therapists, physical therapists, occupational therapists. We're even looking at teachers who work with kids with autism. And again, really focusing on those who provide this weekly, ongoing care. On the caregiver side, we want to keep them absolutely in control of all of this information, but we want to ease the pain of providing update from each provider. And on the patient side, we're not leaving them out of the picture. We are giving them a role to play as well. But I'll get to that after I show you a little bit of the platform. So VidaPost is a communication platform connecting every provider that's involved in an individual's care. On the caregiver and or patient side, they control who gets to talk to who. So they can invite in close family members and friends, and as well as all of their providers. But they have strict control over who's actually getting to talk to who. We're also very focused on the measurable information. So our goal is to integrate in with various different devices that are tracking real-time information. So it can be as simple as if they're using a Fitbit device or maybe a glucose monitoring device for diabetes, but we want to incorporate the communication along with the real-time data that's coming in. So in addition to connecting all of these providers, we believe that connection can really improve the overall collaboration of care, improve the management of care, and really enable the caregiver and the patient to focus more attention on improving their health and wellness rather than just on managing their condition. So what is the patient's role that I was talking about? I have to actually give Katie some credit for the name of this because we were talking about we met a little bit ago. I was explaining the Wellness Ambassador Program, and she's like, oh, I really like the wisdom side of it too. So what we're doing is basically giving our patients a role, and they are applying to become an ambassador. We currently have 5 ambassadors who are adults with Down syndrome who will be partnered with the elderly, and or you yourself can apply to have an ambassador that basically would provide a daily update, a tip. But we're just keeping that personal communication open between somebody with a chronic condition and a potential elderly, or again, it can be anybody in the community who's looking for a story to tell. We could partner with Condoma and they can tell stories abroad. As an ambassador, they have the option to become part of the VidaPoints program. So as participating in this communication, every time they send an email or send a video, they earn points for doing so. These points will be redeemable for discounted health and wellness services so they can continue on their path towards improving their health and wellness. Our role, the VidaPost team, again, I'm the founder, and we have Dan, who has over 30 years as an architect, and he's leading our development team. Trish, who's worked with Epic and Direct Supply in Wisconsin, so has years of sales and product development on healthcare technology. And then Tracy is making everything pretty. We are excited. Next week, we're actually chosen by Aetna to integrate in with the CarePass platform. So we'll be attending that workshop next week. And what's your role? Your role as an investor, we're now looking for seed money. We're looking for various partnerships, and in 2 weeks, we'll officially launch our site, and at that point, we're looking for you to join our network and take the pledge either as a provider, caregiver, or patient. Choose your role. We hope you join our journey.